Hi, this is Scott Levy, Chief Medical Officer at Doylestown Hospital, back again for a talk regarding COVID-19, and coronavirus. So where do things stand? Things are certainly improving as you see the numbers as well as I. The number of cases locally as well as nationally have trended down significantly over the last couple months. Keep in mind that we're still in excess of 50,000 cases in this country. And although that's certainly a lot better than nearly 300,000 cases right after the holiday and the new year, we're still about where we were last summer with the number of cases. And at that time, everybody was concerned about 50 or 60,000 cases, and that was a real problem. Now we're almost celebrating the fact that it's only 50 or 60,000 cases. Nevertheless, we are optimistic about the near and certainly the long-time future. Vaccinations continue to ramp up. As everybody knows, Pfizer has increased their allocation of vaccines because they shortened the time to manufacture. Moderna has indicated they also will be able to bring more vaccine to market. And also, we now know that Johnson & Johnson is literally days away from very likely having the ability to distribute vaccine throughout the country. Please don't focus at all on the statistical minor differences in the efficacy of the various vaccines, because you've heard that Johnson & Johnson is only 75%, Pfizer's 95%. Well, that doesn't sound nearly as good. And when you look at Johnson & Johnson against some of the new variants, it may be even worse than that, such as in Africa, in South Africa, for example. There's only one number that really matters. Is not whether it's going to prevent the disease so much, is whether it's going to prevent you from dying or be hospitalized for the disease. And Johnson & Johnson vaccine has been 100% effective in preventing deaths. That's the number that really counts. That's very similar to the Moderna and the Pfizer vaccine. A large study of Israel demonstrated that those two vaccines nearly stopped in its track hospitalizations. I don't need to say anything more about the value of vaccine if it's going to prevent death and hospitalization. Doylestown is working very aggressively to get as many different tracks for vaccination as possible. We've talked about the risk stratification methodology, and any patient who's seen a Doylestown Hospital medical staff physician, whether specialist or primary care, who's eligible for vaccine is already being stratified. We're trying to get your local citizens who are at higher risk than you in first. We're prioritizing that, but your turn will come in the near future. For those folks who don't have a Doylestown Hospital physician, whether specialist or primary, or for some reason can't wait, the Department of Health has the mechanism to register to get vaccinated there. The retail pharmacies do, and Doylestown does as well. We offer spots and allocations of vaccine by calling our number or by going online through our homepage, and there are spots allocated there. However, that's, as you know, a very difficult process sometimes to get a spot that way because the demand is so high. So for those folks who have a physician within the system, we'll be reaching out to you when it's your turn. In the interim, please continue to wear your mask, talk to your friends and neighbors about getting vaccinated, help dispel some of the myths about vaccine, because there's only one thing that really counts. These vaccines are extremely effective, and these are the things that we really see are going to turn the course of this disease, as we've already seen elsewhere. Be good, be careful, wear your mask.